Hello and Assalamu alaikum, ladies and gentlemen. Welcome to yet another episode of the Dental Talk. Today we have a very special guest with us, someone I've been following for many years and someone I've always looked up to as a dentist. I'm sure you've all heard of him, and if you haven't, you're probably a dentist living under a rock or does not use Instagram. His name is Dr. David Montalvo Araiz. He is a dentist hailing from Barcelona, Spain, where he got his bachelor's degree. He went on to train in periodontology and advanced implant surgery at the same university. He currently practices in Dubai, but after doing his master's in periodontology, he went on to do the advanced training program in aesthetic and restorative dentistry at the NYU Dental College, where he earned his advanced aesthetic degree. He has been a keen speaker at many national and international conferences. He has many published researches. He is currently the part of the European Federation of Periodontology and the American Association of Cosmetic Dentistry. He leads many continuing education programs in Dubai and in NYU, and he currently works at Aesthetics and Cosmetic Dental Care, which is one of the world's leading dental clinics with branches in New York, Los Angeles, and Dubai. So with a profile like this, I'm sure Dr. David has a lot of inspiration and motivation to give us, and I'm sure the way he practices dentistry, we can learn a lot from him. So without further ado, ladies and gentlemen, Dr. David Montalvo Araiz. Okay. Hello, Dr. David. How are you?
I'm good. Hello, how are you?
I'm good. I'm good. How's the lockdown going? How's the quarantine life going?
Well, it's been actually nice
Mm-hmm.
somehow because I spend a lot of time with my son, and that's something that I don't really do very often. But I really
Mm.
had time to spend time with him and see him growing. He's like 1 year old now,
Oh,
so that was the positive part. But at the same time, it was very frustrating not being able to do my passion, which is aesthetic dentistry. So it was a little bit long, so I couldn't you know stand
oh,
it
I'm
anymore,
sure.
and I just wanted to go back to work.
I'm sure. I'm sure. Okay. So with your permission, should we start the interview?
Yeah, of course.
Okay, so let's start with a bit introduction of yours. I'm sure many people who are watching this video already know you, but for the people who don't, just take us through a journey through dentistry. When did you decide you wanted to be a dentist? How was your journey through dental school in Barcelona? How did you get into dentistry, and how were those undergraduate years during dentistry?
So, well, the reality is that at the beginning, I didn't want to become a dentist.
Okay.
My real passion at the beginning was architecture. I wanted to be an architect, but I guess that because my father is also a dentist, when I was around 15, I decided to start working with him as a dental assistant,
Oh
and
wow.
so I could see like what was dentistry, because when you're at high school, you don't really know what what's a profession. So I spent some time in the clinic. I was helping him, and I was able to know better what was really dentistry,
Hmm.
and I really enjoyed it. I thought at the time that it was something that I could do the rest of my life because it was like a flexible profession, something that it's also very manual, very like you need to
Yeah.
craft, you need to know your craft as well. It's kind of like artistry and science all together. So I think that's why I decided to take that path. And that
Okay.
was around 20 years ago. And yeah, I decided to study dentistry. I studied dentistry in Barcelona, and yeah, I spent 5 years there at the University of Barcelona. It was a very competitive environment. It was a public school, so we were like 100 people in the same class, and we were all like trying to be the best, and that's something that I think that still nowadays is something that really got me at
Hmm.
that time, and
Hmm.
that kind of competition is something that I always have in my mind, like always trying to be better and
Hmm.
to try to not compete in a bad way, but also like you don't want to be the last one in your class, right?
Obviously.
So that's something that I was like doing at the time, and that I think that really helped me grow and get to where I am right now. So after that, I was working as a general dentist for like 3 years, so I could like learn a little bit of general dentistry, like practicing a little bit of everything, like a little bit of surgery, a little bit of endo, a little bit of restorative, pros. And then I decided that I wanted to get a little bit farther into the surgical part. And I always like the detail, the precision. So I decided to go to perio because I found that it was way more precise than just oral surgery. Oral surgery for me at the time was a little bit, gross and too big. So I wanted to be more like specific. So I did 3 years of perio also in Barcelona. And then I started working just as a specialist. I was just doing surgeries and implants and grafting and all that kind of work. And I was doing that for like 2-3 years, I think. And after a while, I noticed that I wasn't really happy with the way the cases were finishing, especially when I was working in the aesthetic area. And that was really pissing me off because the cases that I was doing in the aesthetic area, I also noticed that those were the cases that were really motivating me. I was really working really hard. But when I was getting the final result after like the restorative part, I wasn't really happy. And I felt that there was like a lack of communication between the surgical and the restorative. I found it very difficult to communicate in detail and being precise doing that, So that's why I decided to go to New York and study the other side of dentistry at the time for me, like aesthetic. The restorative part.
The aesthetic dentistry part,
the aesthetic dentistry, which opened my eyes. That was like really like the game changer for me, because the way I understand dentistry right now, it's completely different than 10 years ago. When I did aesthetic dentistry, I understood the role that the aesthetic dentist or I don't like to call it the aesthetic dentist, because it should be like the director of the treatment. There should be always like one person that has the vision of what needs to be achieved, and that person should be the one guiding the rest of the of the team members. In my case, I wanted to decrease the number of team members. That's why I decided to do the restorative, the implant, and the perio part, which is like a huge part of the dental work. Now, I'm still working with a root canal specialist, or I'm still working with an orthodontist to achieve some results that I want in some specific cases. But in many situations, I can wrap around everything and do it myself, and that avoids that problem in the communication for me.
That was my second question, that you've been practicing so many specialties. You've practiced perio, you've practiced aesthetic dentistry, a bit of prosto as well, I assume. And so how difficult is it for a dentist to practice multidisciplinary dentistry, and how have you gone about it in your career?
Well, what I believe is that it's just a matter of time. It's just a matter of effort and training and spending time learning. I hear some people saying that you can only be good at one thing, but I don't really believe that. And especially in dentistry, I don't think it's such a big job. It's not the amount of specialties that we have.
Yes.
I don't think they are so big, because we are already like a specialty in medicine, So the way I see it is that the more you know about all those specialties, the better dentist you will be. So that's why I try to handle as much as I can. And also, I don't want to go and also do ortho in my case, in my situation. I don't want to do ortho, or I don't want to do root canals, because I don't enjoy them. So I try to limit also my practice to what makes me feel happy, And I know that my passion and what makes me happy is aesthetics. And I don't like to differentiate. I don't like to differentiate pros or restorative or perio or no. For me, it's aesthetic dentistry, and to me, it's not even aesthetic dentistry. That's dentistry. I think the prognosis of the treatment.
Amazing. Moving on, let's move a bit back in time. How were your early years as a dentist when you've just graduated dental school, and you have no idea what to do. You've just graduated. What were those years like, and what would your advice be to a person who has just graduated dental school?
So, well, I mean, I think I was lucky because I at the time I was able to work in my father's practice.
Okay.
So I was working for him, and also because I didn't want to be only working with him under his umbrella. I
Hmm.
was working in two different clinics, so I could have like different experiences at the same time. But it's true that the best part for me is that when I came out from school and I started practicing, I think it's the same as everyone. At the beginning, you think or you believe that you know everything. It's like, okay, now I'm a dentist, I know everything. But the reality is that you know nothing.
You know
And
nothing.
once you start working, you
Yeah.
realize little by little about it. Luckily for me, I had my father working, in the next room.
Hmm.
So whenever I had a problem or I didn't know how to
Okay.
face something, I
Hmm.
could always call him, and I was like, Daddy, come here and help me. How would you do this? So it was like having a faculty full time with me.
Having a
So that
mentor.
really
Yeah. Having a
exactly
mentor.
exactly. So that really helped me. But at the same time, I was working very hard to make sure that I didn't have to ask him because I'm a very
Hmm.
proud person. So I was
Okay.
always like, no, I don't want to go show him that I don't know how to do this. So I was always preparing every single case that I had to face, like I was reading about it and
Hmm.
checking how could I do it. And so if you ask me for like recommendation for like a fresh dentist, try to find someone that can guide you at the beginning. Don't
Hmm.
be too brave because you can create big damage there.
Yes.
So it's
Yes.
important that you are also careful with what you do, and you try to learn from someone, at least like someone that has been doing this for few
Yeah,
more
it
years
makes
than you.
sense.
Because
Yes.
even if it's not the best dentist, it's still someone that has been facing way more problems than you in a daily basis. So you can always learn something from that person.
That you're very Instagram famous. You have a huge following on Instagram, and your cases are
Mhm.
absolutely amazing. And I know that I've been following you for over a year now, but I'm sure your following on Instagram grew over time. It took some time. But if I had to ask you, what's the one good thing and what's the one bad thing about being an Instagram famous dentist?
Well, I mean, it's funny that you say Instagram famous dentist. I don't consider myself like that, but um, the good thing of the good thing of Instagram and social media in general is that it's a very powerful tool to reach to a lot of people in a very easy and also in a free way, in a cheap way, because
Yes.
you don't need to spend money. It's like a free advertisement. And in
Yes.
fact, the way I try to use my Instagram and the way I try to project it, this is not intended to be to attract dentists.
Hmm.
Although I know that I'm attracting dentists because
Yeah.
we like to see what everyone else is doing, right?
Yes.
But my goal is actually to attract potential patients.
Patience.
I want them to be able to see what I'm doing. That's why I'm really caring about the way I'm presenting everything in my profile, because I
Okay.
want them to I want them to get an idea of who I am by my Instagram profile. I want them
Okay.
to see not only the way I work, but I want them to let them know that I care about detail, that I'm a clean person, that I'm
Yes, that
I'm
makes sense.
into like aesthetics and I know about all these things. So that's a good thing. It's a very powerful tool to reach population.
Okay.
The
That.
On the other side, it's something very demanding. If you really want to take
Yes.
advantage of Instagram, you need to be very consistent, and it takes time, and you need to plan. You need to be there all the time. So you are always, you know, every time that someone is gonna go to their cell phone and check Instagram, you always gonna be there.
Yeah.
Every time they scroll down, you want to be there, and the only
Yeah.
way to get that is by being consistent and posting every day and trying to be different, trying to be interesting, and
Yeah.
trying to also educate them and give them something that they didn't think about before. So
Okay.
it's
Yeah.
very hard. It's very hard, and I'm not going to talk about the haters, which is something that it's also there, of course. When
Okay.
you are when
Really?
you're of course, when you're exposing yourself and when you're exposing your work and whatever you do, there's always people that will come back with their opinion, and I respect that. Everybody can have an opinion about you, about whatever. But unfortunately, it's also a platform that allows people to just be rude, and that's also
Yeah,
the downside. You
that
can
is.
say whatever you want, but just don't be rude. Just be polite, and also try to understand the person that is behind that.
Obviously you put the groundwork in, you worked really hard, you went to NYU, and now you're working at one of the world's leading dental clinics in the world, Aesthetics. Tell us a bit about Aesthetics, what it is, how it's like, not its origin, but why is it so important to give a 5 class service to your patient, and the way you guys do it so amazingly at your practice? Why is it so important that your patient deserves a 5 class practice?
Well, I mean, one important reason for me is that I value what I do.
Hmm.
I value my work, and I also want to be rewarded for that. And
Hmm.
dentistry, when you want to do it in the right way, is not a cheap thing, you know. So
Yes.
of course, when you want to charge your patients a specific amount of money for your services because you think that it costs that, it's a value that you think it's worth, you need to deliver something extra,
Yes.
and the technical part of dentistry is not that difficult, and you'll find a lot of amazing dentists in the world, a lot. There are a
Yes.
lot of dentists that they will be like really, really good doing the technical part, but you need to differentiate yourself somehow, you know and the way we find that we want to be different is not only by doing great dentistry, but also trying to give our patients a great experience, because at the end
Yes.
of the day, patient, they don't really have the knowledge or the skills to really compare you as a
Yes.
dentist. So
Absolutely.
what they can really see is how you treat them and the experience that they go through, and that's what they're gonna remember, and that's what they will
Absolutely.
be
Beautiful.
telling their friends, their family members, and that's what's gonna bring you more people. So that's why for us it's so important to deliver that experience, that extra care, that 5-star
Service.
treatment
Yes.
that you
That
mentioned before.
makes perfect sense. Okay. So my next question is something that we have to ask every dentist, and I'm sure you've been getting that a lot lately. COVID-19. Who knew that a pandemic like this would come and absolutely cause massive havoc in our world? And probably one of the worst affected professions is dentistry. So, how do you view it? How is the situation in Dubai? How are you dealing as a dentist with COVID-19? And what do you think the future of dentistry is?
I mean, COVID, it's something that it's new, but in reality, we've been exposed to potential viruses or diseases for ages before.
Yes.
It's just that this is something new, and it's still not under control. And that's forcing everyone to take extra precautions in terms of personal protection for the patient. Of course, we are working now, taking those precautions like fully covered,
Yeah.
wearing like double mask, wearing like face shields,
Face
covering
shield.
everything. The rooms are like extra disinfected
Yeah.
nowadays. Every time we're doing like a patient that is coming now with for a big treatment, for a preparation, we are taking PCR test to make sure that they are like healthy, like the 48 hours before doing it. So we are
Okay.
doing that extra step to make sure that we are safe, but also our patients are safe. We are also taking our tests once a week almost.
Oh wow.
So
So you're doing the PCR test at Aesthetics of every patient
yeah, yeah,
48.
yeah, yeah.
Okay,
We're
that's amazing.
we're
Wow.
doing that for our patients so we can, protect everyone. And
Yes.
people are accepting it and they understand it. So that's good, because I thought that it was going to be a little bit tough for them to accept it, but they understand, and you explain them that it's
Yeah.
just part of that extra care that we were discussing before.
Absolutely.
And the future of dentistry, I mean, eventually, I think we'll get back to normal. Honestly, we'll get back to work like the same way we were working before. Hopefully, once we get a vaccine, we'll start working, with some precautions, but not being so scared as we are right now.
Yeah, absolutely.
That's the way I see it. And the future of dentistry, well, if you're talking about aesthetic dentistry, of course, digital is coming. It's coming. It's coming.
Yes.
I think for some things it's still not there, but it's just growing, and
Absolutely.
it's just making things easier for everyone. So I guess that's where we are going, right?
Digital smile design is an amazing concept, and you guys have been working on it amazingly. You and Dr. Appa, it's amazing the way you guys use it. Okay, so my next question is a bit about dental photography. You are an amazing dental photographer. There are many people on Instagram who are amazing dental photographers. How important is dental photography for a young dentist, and how important in return is social media for a young dentist? You've answered the social media part. How important is dental photography in your opinion?
I mean, let's put it into separate things, because social media and your profession are like two things separated to me.
Obviously.
I mean, my advice is that the sooner you start taking good photography, the better, the sooner you will become a good dentist.
Okay.
And it's that simple. You cannot do good dentistry anymore without dental photography. It's just like that.
Okay.
It was a game changer for me. Like, once I started taking pictures of what I was doing, I was able to see all the mistakes that I was doing. I was able to study my cases for a long time in front of the computer. It's just like opening your eyes. So, guys, young dentists, one of the most important things you have to learn: good pictures. Okay, and I'm talking about good clinical pictures. And then you once you start understanding how photography works, you will get to the artistic part of the photography, which is what we all like about, incisal edges and lips and all these details, to show other people like how cool it can be a picture. But those pictures, in reality, they're worthless for your daily basis.
Yes.
Yeah. Now,
Absolutely.
if you're building a brand, and that's something that you start doing since day one, if you're building a brand as a professional and you want to explain who you are to your audience in Instagram or whatever social media you want to use, dental photography, it's a very important tool to show people what you can do.
Talking about brands, this is a brand that we're trying to introduce here in Pakistan, the Dental Talk. We're moving to the last part of our interview. Just some last words for our brand. What do you think about this startup of ours for Pakistan?
I think it's great. I mean, Pakistan, it's a country with a huge potential, because I mean, we were talking before and you told me that there are many things in Pakistan that they haven't been done yet. So what this is giving you, it's a great potential to do things, right?
Absolutely.
So just building a brand, being so young, and having this vision and this idea, it gives you a lot of potential. So it's an amazing thing. And it's also an amazing thing to do, because it allows you to help your profession and your colleagues.
Absolutely.
So it's the values and the core behind that. It's also very nice.
Thank you. Means a lot, sir. Any last words for the dentists of Pakistan? Any advice that you could give us as a dentist?
The only thing I can give you is the only thing I can tell you is to just try to find what's your passion as soon as possible, and once you know that, work as hard as you can, because that's the only way you're gonna get better and better and better. And hard work pays back. I'm sure about it. It's like, people can be lucky, but the more you work, the luckier you are. So
absolutely.
It's all about hard work, vision, and having a goal, and going for it.
Absolutely, sir. Sir, thank you so much. It was an honor. It was an absolute honor talking to you. Thank you so much for giving us your time from your busy schedule. I hope you enjoyed the interview, and it's been an honor. Thank you so much.
Yeah, of course. hopefully one day we can do one interview in person in Pakistan.
We should definitely, and you should definitely visit Pakistan once this COVID-19 thing is over. You should visit here for a course or something, because I'm sure many people will die to learn from you over here.
Of course, will be my pleasure. Will be my pleasure.
Thank you so much, sir. Yeah.
You're welcome. You're welcome.
Thank you. Goodbye.
You're welcome. Bye bye.